Hi, my name is Hsiong Chen, and I am a teleneurologist with TeleSpecialists. So let's talk about what TeleStroke is. When a patient presents to the hospital with stroke symptoms, a neurologist may evaluate the patient through a video conferencing system. This system allows the neurologist to interact with the patient in the same way as a face-to-face encounter, but reduces the time it takes to get to the bedside and allows the hospital immediate access to neurology specialists 24/7. A telestroke visit begins with recognizing when a patient has stroke symptoms. Stroke symptoms are varied and include sudden weakness or numbness affecting one side of the body, facial droop, slurred speech, or vision loss. It's important to call 911 as soon as you see or feel stroke symptoms. EMS will then transport the patient to the hospital where they will be met by the ED doctor and nurses. A teleneurologist will also evaluate the patient, typically within 15 minutes of arrival to the hospital. The first half hour is very hectic as the patient will be evaluated by doctors, get vitals taken and blood drawn, and undergo CT scanning of the head. A teleneurologist will interview the patient through the video conferencing equipment, and the nurse will assist with the examination. The neurologist will determine when the stroke symptoms started and assess the severity of the stroke. If symptoms started within the past 4.5 hours, the neurologist will determine if the patient is a candidate for thrombolytic therapy. Thrombolytic medications are clot busters that dissolve blood clots in the brain and can help reduce the damage from a stroke. The neurologist will also determine if the patient is a candidate for thrombectomy. This is a procedure where a catheter is inserted into the vessels of the body, travels up to the vessels of the brain, and pulls the clot out of the brain. This is possible only in patients who are having a major stroke with a blockage in one of the major vessels of the brain. The next step is to determine where the stroke came from so we can prevent the next stroke. The patient is admitted to the hospital where doctors will assess their stroke risk factors, usually with an MRI of the brain and vessels of the head and neck, heart evaluation, and monitoring blood pressures, blood sugars, and cholesterol levels. The patient will be put on medications to bring risk factors under control to reduce the risk of another stroke. While in the hospital, the patient will also undergo evaluation for therapy needs. Depending on the symptoms, the patient may need a combination of speech, occupational, and physical therapy for recovery. Therapy can occur at home or in a rehab facility based on the patient's individual needs. Once the patient is discharged, they will continue to follow up with their primary care doctor to ensure health maintenance.